of the children tested positive. Well, it comes as a further 360 people died from the virus in British hospitals, taking the total number of deaths to more than 21,000. But that figure does not include coronavirus deaths that have taken place outside hospitals. The British government is facing growing criticism for not acting sooner to contain the outbreak. The UK death rate is now set to overtake both Spain and Italy. The UK death per million is about 311. In comparison, Germany's is only 72. Both countries have just under 160,000 confirmed cases of COVID-19. George Batchelor is the co-founder and director of Edge Health, which uses data to help the UK healthcare system. He joins me live via Skype. Thanks very much indeed for being with us. So, from what you've seen in the modelling you're doing, where is the UK in terms of the peak?
So it looks like the peak in the UK happened around the 10th of April.
And where does that leave us now in terms of the possible changes to restrictions?
So it looks like the number of people that have been infected is actually still quite small. So probably there are 50 to 60 million of us who haven't had the disease. And as we start to think about releasing some of the lockdown restrictions that have been very effective at actually reducing the spread of the disease, there's still a very real risk of a second wave of COVID, a second peak of COVID coming back. So it's a very treacherous time.
At the moment, can you tell us how it works in terms of the modelling? How reliable can any model be if you don't know how many people have actually already been infected?
So that's a really good question. The modelling is only as good as the data and the evidence going in. And when there's something that has so many unknowns as COVID-19, where we are still learning every day, and we've never seen the effect of things like the lockdown before, and we've never modelled pandemics like this, or probably never will model them again. But what we can say with some certainty is that we know much more about it now than we did at the beginning of March and early April. So we have much better ability to model things going forward, I think it is fair to say.
So at the moment, what figure is more important? Is it the death rate or the rate of infections?
So the death rate is the only real metric that matters. It's the only one that we know for sure is accurate across different countries. And by following other countries' death rates, when they're releasing some of the lockdown measures, we can learn quite a lot about which lockdown measures are likely to bring back a further wave of COVID. So definitely following the death rates. I think following infection rates is really tricky because of the way that testing is being done at the moment. Because testing is being ramped up, it's very hard to say whether when we see an increase in the number of infections, whether that's because we're just testing more or whether there are actually more infections.
And is the government modelling or the NHS modelling for the effects of the lockdown at all? Have you been asked to find out how many extra people will be dying from, say, heart attacks or cancer and so on, or the other effects of the lockdown?
So it's definitely something that we've been looking at, and it's certainly, I imagine, something that the government has been looking at. What we have seen is that in the early part of April, there's been a relatively high increase in the number of non-COVID related deaths. So these look like they might be from people that are choosing not to go into hospital if they've had a small stroke. What we will start seeing, although not as quickly, is the effect of cancelling some of these elective operations and diagnoses, which will lead to people with cancers that go from being treatable to being untreatable. And we'll most likely start to see an increase in mortality from that as well.
Just very briefly, have you been modelling also the kind of you mentioned that you obviously learn from other countries on what's happening with as they ease their restrictions. Have you actually looked at what particular scenarios for lifting lockdowns, and if so, what's the most effective way of doing it in terms of reducing mortality as well?
So it's a very difficult question to answer, to be perfectly honest. I think what is clear is that there are a range of measures, protective measures and processes that can be put in place so that when lockdown is released, it will not lead to as quick a spread of the disease if indeed one comes back. So things like wearing face masks, or perhaps returning to work but for limited periods of time, or allowing certain industries to start before others.
Thank you very much indeed, George Batchelor, for your expertise. Thank you.
Thank you.
Now, lockdown restrictions in New Zealand have been eased for the first time in almost 5 weeks. It means some businesses take away food out